Dr. Hardy Davis Jr. is mayor of Augusta and a former member of the Georgia House of Representatives and State Senate. While Augusta has notched impressive economic development results under Mayor Davis's leadership, helping Augustans to live longer, healthier lives is also a major priority for the mayor. He uses the National Forum's Move with the Mayor platform to encourage Augustans to be physically active and to educate the public about blood pressure control and protecting themselves from COVID-19. Dr. Davis has a certificate in health policy from Georgia State University. Mayor Davis's fellow mayors recognize him as a leader. They have elected him president of the African American Mayors Association and trustee of the U.S. Conference of Mayors. I call him Dr. Davis because he earned his Doctor of Ministry degree, and in addition to serving as mayor, he serves as senior pastor of Abundant Life Worship Center in Augusta. Today, we are pleased to talk with Mayor Davis as a champion for health equity and cardiometabolic health. Mayor Davis, welcome.
John, thank you so much. I really appreciate the partnership that we've been able to form over this past year with the National Forum for Heart Disease and Stroke Prevention. You guys have been incredibly responsive and supportive of our efforts here in Augusta, Georgia. And I couldn't be more proud than to help champion this cause around the Surgeon General's call to action around hypertension.
Well, that's great. We really value the collaboration with you and your team, Mayor Davis. Mayor, why is blood pressure control important to you as a mayor?
Well, it's important for me, one, because of my concern for all of our residents, some 204,000 residents that make up the city of Augusta, but from a personal perspective, as someone who's been challenged with hypertension from my days in the legislature. I remember it vividly like it was yesterday, me making my way back on a Monday morning to the legislative session, final days of the 2008, quite frankly, legislative session, my second year in the legislature. And I remember making my way up I-20 and feeling this tightness in my chest and not knowing what it was and really what was going on. I did the first thing that most sons do, and I picked up the phone and called my dad. And my dad says, well, is it this, is it that, or the other? And I made my way on into downtown Atlanta to the Capitol. And as I went through the course of that morning, my seatmate recognized that I looked flush in the face, and he was concerned. I went down to the doctor of the day, and the next thing you know, I've got a blood pressure of 220 over 160, and I'm trying to get through day 37 of the legislative session. And I went back up and, thought I'd feel better. And my seatmate looked at me again and said, I'm going to get the doctors. I'm going to get state troopers. And they rushed me to the hospital. Little did I know at that time I was diagnosed with hypertension. And I've taken a low dose of meds from that time. What it caused me to do, John, was to really focus on my health. Not just from a hypertension standpoint, but just overall, my diet, my weight, and all of those factors that play a role in blood pressure. So this is extremely important to me, not just from my care and concern for the citizens of Augusta, but most importantly, my own personal health and well-being, so that I'm able to live a long, healthy, and prosperous life.
And how, Your Honor, how does your personal experience and the concern for people's health that has given rise to, how do you tie that into the commitment that I know you have to health equity?
Well, that's extremely important. I mean, when you look at communities like Augusta all across this nation, you want to, especially in this COVID environment, we've seen the challenges around healthcare, the issues of health equity, particularly around access to quality and affordable healthcare. Those are longstanding issues in communities of color, Black and brown communities. When you look at the challenges associated with those comorbidities around the virus, they are systemic and chronic in communities of color. And so for me, as a champion for health equity, it was extremely important for me to not only launch Move with the Mayor in our city, but look for ways to bring people into a broader conversation about our overall health and well-being as a champion for that, personally, but professionally, and wanting Augustans to live a healthy life. I know how important it is to bring that into our healthcare continuum to the conversation and the table, quite frankly. And in this instance, to the walks and the exercise things that we've done. Because so many times people become sedentary in their life. They go from one job to the next. They find themselves working in the public sector or private sector, and they become sedentary in nature. And so for me, I wanted to look at that entire healthcare continuum. What is our role as individuals? What is the role of the healthcare community? And what can we do as a city to promote wellness and healthy living in a way that's creative, fun, and quite frankly, constructive? But it's a way for people to connect around common issues in a way that they don't have to be afraid of this thing called high blood pressure and all of the historical implications of what we've heard and seen. I mean, high blood pressure can lead to strokes. Those are real issues. And so for me, we've been able to have a conversation or a series of conversations in a way that I believe have proved fruitful, but also bring equitable matters to the table of how people can get the access and the care that they need.
Mayor Davis, we know that you are leading in Augusta, and we know we have folks from over 100 organizations spread all across the United States who are listening to us right now in this convening. And I'm hoping that some of them will be able to take things that they hear from you and put them to work in their communities. And I know as well, as president of AAMA and as a leader of the U.S. Conference of Mayors, you have other mayors seeking advice and ideas from you. So when you take what you know about advancing health and health equity in Augusta and offer advice to your fellow mayors, what are the top 2 or 3 suggestions that you have that you can share with them for how they in other communities can help raise awareness of the importance of, say, hypertension control and of taking charge of one's own health? And then how, as a mayor, you can not only provide that communications and leadership, but also advance policies that will make it easier for people to do those things in their lives.
Absolutely. You know, for me, I think about the positive power of mayors leading by example across this country. My good friend Steve Benjamin, just down the road in Columbia, South Carolina. I think about Mayor Sharon Westenbroom. I think about all of those other partners that we have who have engaged with the good work that's being done by the National Forum. And I think about, for me and them as well, that I just mentioned, of how we've been able to leverage our platform called the Office of the Mayor and have convenings. So in cities all across America, you can begin with a commitment to your own personal health and well-being. I think everything starts there, leading by example in terms of how you take care of yourself. It's not enough to just exercise, but you have to have a good diet and really being willing to share that with people from all walks of life, and then looking for ways to bend that arc into the healthcare community of where we bring those healthcare providers who take care of us into the conversation. I'm very fortunate to have one of the chief cardiologists in the nation as my friend, but also my doctor, Dr. Mac Bowman, who's a champion for all of the things that we've done with Move with the Mayor. He's led that conversation with me, to include having a very broad conversation about the challenges associated with the virus and how it attacks people's health system. And so when you can, one, leverage your role as mayor, and take the pulpit that you have available to you to talk about your own personal health and wellness, and then bring that conversation to those healthcare providers who we enjoy the benefit of having access to, and then taking those same healthcare providers, thirdly, into the community because they want to give back. They want to make investments in their own communities as well. You cannot lose sight of those types of opportunities. And I think, fourthly, knowing that if you live in a community where there are research institutions or institutions of higher learning, how do you bring them into the broader conversation as well, especially for those that are children at younger ages? I think about just a year and a half ago, almost 2 years ago now, of where I partnered with our local university, Augusta University, in competing for one of the grants through the U.S. Conference of Mayors for childhood obesity and health.
Mhm.
And so we were very fortunate to win as a mid-sized city. Those types of conversations of where we're able to go into daycares, go into the child care facilities and centers, and talk about what is it to prepare healthy snacks, healthy lunches, healthy meals for children so that they don't develop those comorbidities at an early age. We've found that to be very important for us in Augusta, so that we are trying to address these challenges across the entire life cycle of individuals, not just when you get my age and where you're starting to be concerned because somebody told you you had hypertension. Those
Right.
are things I would encourage people to do.
Terrific. Thank you. And I know you certainly are a champion for economic development in your community. You've talked about being a champion for health and for health equity. I believe one of the concerns that you have and that you've addressed in Augusta is food security. And I know from our conversations at other places that you connect those dots. Those aren't siloed issues for you. They come together. Can you speak? We only have about a minute left, but can you speak, Mayor Davis, to how those dots connect and why, say, the health of Augustans is important to the economy of the city?
Without question, health and wellness is, in fact, economic development and growth. If you do not have a healthy, stable, and viable workforce, it's very difficult to move communities forward. When you look at Augusta's health stats, again, just for around cardiovascular disease, 241.3 deaths per 100,000 compared to the average across cities of 211. We know we've got work to do. And so who better to champion that cause than the mayor? I can tout Augusta's tremendous success around economic growth and development, leading the state, quite frankly, the last several years, even during the pandemic. But the success of that really and largely is tied to how do we take care of people? How do we present them with healthy options, not only around eating, but where there's food insecurity? How do we go beyond just popping up stores that are fast food in nature, which we are happy to have them in our communities, but people need healthy food choices. We've restarted the market, the Saturday market here. We've also got a market that we've partnered with the American Heart Association to have that provides fresh fruits and vegetables in the community, as well as canned goods that are fresh in nature. And so these things are extremely important to us. And I would encourage communities across America and our fellow mayors to look for ways to do those same things because food insecurity is a challenge, not just in Augusta, but across this country. This is something we can win, and especially when we've got the support of the National Forum and your team, John, have been very helpful in providing us with data sets where we can make those investments in our community. And so I want to applaud you and thank you for this continued relationship.
Well, thank you again, Mayor Davis. It's really a pleasure to collaborate with you and your team. Hardy Davis Jr., the mayor of Augusta, Georgia, a champion for cardiovascular health, a leading participant in Move With the Mayor, and perhaps most importantly, a champion for health equity. We thank you, Mayor, for your work, and we thank you for joining us today for this conversation.
John, thank you so much, and I look forward to seeing you soon.